Times have changed, and how we see and implement tradition in almost all aspects of life has changed with them. How Muslims engage with these changes and their effect on mental and spiritual health is subject to deep reflection and study. However, we definitely see a profound need and yearning for connecting to the divine in our healthcare by implementing the Islamic tradition. In terms of mindfulness, Islamic tradition is rich in many kinds of meditative practices. Cultural traditions have also shaped and formed most of these meditative practices. Among these meditative practices, Muraqabah is rich and deeply rooted in Islam's spiritual mystic tradition, Sufism. There are various Muraqabah practices, and each has been shaped by great Sufi masters, all of whom linked the Muraqabah tradition to the prophetic tradition. Most of these mindfulness practices come in visual, auditory, or kinesthetic styles, but sometimes they integrate all of them. There is one truth: we are at the earliest stages of development in our understanding and implementation of Muraqabah in healthcare. One important question from our inquiry into Muraqabah and psychotherapy is how to proceed from here. What is the next step and direction? Second, when we reviewed Islamic mindfulness's historical narratives and contemporary applications, the question of their potential therapeutic effects arose. Of course, as can be discerned from Islamic psychotherapy literature, these practices can have many benefits. However, we need evidence-based research to find the best practices for implementing Muraqabah. It is encouraging and inspiring to see how many Muslim psychiatrists, psychologists, psychotherapists, and others are deeply interested in and care about studying the effectiveness of Muraqabah in Islamic psychotherapy. As we know, in the past, as an Islamic mindfulness practice, Muraqabah was recommended for spiritual purposes. The research being done by inspiring Muslim researchers and therapists, however, shows that Muraqabah has many other benefits. For example, it is becoming a valuable tool in treating mental and emotional disturbances such as severe depression, anxiety, bipolar disorder, personality disorders, and attention deficit disorders. In past and contemporary Sufi schools, classical Sufi orders encouraged practicing Muraqabah under the direct leadership of a sheikh. This was necessary to avoid not only spiritual misguidance, but also the improper application of Muraqabah. Sufi masters who were trained in Islamic psychology were also skilled at managing unpredictable, unhealthy experiences such as waswasa, i.e., whispers, obsessions, etc., and disturbing or frightening experiences. This example informs us that Muslim therapists should also watch over and guide the client to apply Muraqabah ethically and properly. They should also be knowledgeable and skilled in managing negative feelings such as anger and resentment or hallucinations. Therefore, Muslim therapists who want to integrate Muraqabah practice in therapy should be adequately trained in Islamic studies such as the Quran, the history of Sufism, and Sufi psychology. Training in mindfulness-based therapies will also enrich their vision and experience. Thus, with proper training in classical Sufi psychology and one of the aforementioned mindfulness-based therapies, therapists can help their clients develop self-awareness, loving kindness, compassion, and empathy in their healing journey.